Welcome, ladies and gentlemen. My name's Andrew Jack from the Financial Times. It's a great pleasure to welcome you here today. We're here in London, but we're also simultaneously launching this report, of course, on NTDs in Addis Ababa in Ethiopia, and we should be joined during the meeting direct by screen from Addis to hear from a number of leading champions and advocates involved in the field. We've got a pretty packed programme over the next 2 hours. We will try to keep a hard cut-off of 5 p.m. to wrap up, and then we can move over for a reception. So a final plea to all our speakers, please to be succinct and on time. But neglected diseases, of course, is a very important issue, as the name implies, often has fallen beneath the profile. But certainly in my years writing about health, it's one that I find particularly poignant, partly because it is very much the rural, the remote, the neglected, the abandoned. It's not the high-profile patients. It's not those in richer countries or richer and urban regions, even of poorer countries, that are most affected. And equally, of course, it's a set of diseases that very often doesn't actually require huge amounts of new medical innovation, vaccines, medicines. It requires, above all, human commitment and the delivery very often of existing tools and approaches to tackle. So it was great to see the momentum building over the past 3 years in particular with the London Declaration and the roadmap around NTDs. And the challenge today, of course, is really to keep that momentum going, to hold people accountable, to rationalise and to understand and build on the common links between these diseases, to tackle them, and tackle diseases that, of course, don't simply cause very often very nasty and premature deaths, but also long-term and also rather invisible suffering, stunting, educational deprivation, slow progress, a huge unnecessary roadblock to social and economic development around the world. So without further ado, I'd like first of all to introduce the Assistant Director General of the World Health Organization, Hiroki Nakatani, to make a few opening remarks.
My Lord, ladies and gentlemen, good afternoon. It is my pleasure to be here in London for the launch of the third WHO report on neglected tropical diseases. Dr. Maga-chan, our Director General, has asked me to personally convey her greetings as she was unable to attend this important gathering today. She has, however, sent her message in a video recording that will follow shortly. Now, I wish to thank Baroness Lindsay Northover for her personal presence today. And also, this event, as Andrew said, is being simultaneously held in Addis Ababa, Ethiopia, where many dignitaries have gathered to this important launch. I take this opportunity to get the Honorable Keve Woku, the State Minister of Health of Ethiopia, and other people in Addis. We shall also have opportunity today to hear from Addis Ababa later this event. Among us also today, we have Lord Nigel Crisp and the Honorable Jamie Lefloy, who have kindly agreed to give their remarks. The United Kingdom has been a critical partner and a strong supporter and technical and strategic ally of WHO. Today's subject of neglected tropical diseases is not an exception. With the support of the UK government, we are largely able to tackle many of these diseases, including trachoma, leishmaniasis, and gillyworm disease, which is on the way of eradication. In addition, UK government has stood firm to support UN co-sponsored program, TDR. In recent years, it was a difficult time, but now it is active again and active for research and training on diseases of poverty. On behalf of WHO and our member states, I wish to thank the government, UK government, and its people for generosity. We thank you. Before I pass the floor over to Andrew, as the moderator of this London event, I have pleasure in inviting you to watch the video message from our Director General, Dr. Margaret Chan. I thank you.
Greetings from the World Health Organization in Geneva. This is the third WHO report on neglected tropical diseases. This report is building on previous successes and extends its reach in innovative ways. The report soundly positions this group of 17 diseases on the global development agenda at a time of profound transitions in the economies of endemic countries and in thinking about the overarching objectives of development. In doing so, it reinvigorates the drive to prevent, control, eliminate, or eradicate diseases that make life miserable for more than 1 billion people. The report brings a new dimension to long-term thinking about the future approach to these diseases. For the first time, it sets out financing needs, options, and targets for reaching the WHO roadmap goals by 2020, but also for reaching universal coverage of all people in need by 2030. For the first time, the report makes investment cases, one for cost effectiveness and a second where equity is the focus. In line with new thinking about development in the post-2015 era, the report prioritizes control measures as an integral part of efforts to share the benefits of economic growth more evenly and fairly. Control measures are also put forward as a test case for universal health coverage. By distributing donated medicines to all in need, countries can carve out delivery systems for achieving universal access to other medicines, other interventions, and forms of care. Finally, as the group includes several vector-borne diseases, they are highly sensitive to climate variables. Changes in incidence patterns can serve as an early and measurable signal of the health effects of climate change. Most important is the pro-poor nature of this initiative as a contribution to the desired goal of shared prosperities on a massive scale. With such huge numbers affected, controlling these diseases paves the way for an exodus from poverty. The drive for sustainable results brings better vector control and improvements in water supply and sanitation with it, as these diseases flourish in filthy environments. The report also charts some remarkable and accelerating progress. Further momentum comes from the stepped-up commitment of many endemic countries themselves that see an end in sight and are determined to get there. Well, over 70 countries are implementing or ready to kick off their master plans for integrated and accelerated control. Verification that lymphatic filariasis has been eliminated has begun in 6 countries. Sustained efforts by a network of African countries have reduced the incidence of sleeping sickness by 90%. During the 2012 and 2013, the pharmaceutical industry donated 2.5 billion treatments. These outstanding results are attributed to what committed governments, working with equally committed and enthusiastic partners led by WHO, can do to relieve vast human misery, distribute economic gains more evenly, and free masses of people long trapped in poverty. In other words, when countries and their partners invest in the control of these diseases, they get a windfall of benefits in return. Thank you.
So I'll now turn over to Dirk Engels, the Director of the Department of Control of Neglected Tropical Diseases at the WHO.
Ladies and gentlemen, distinguished guests, good afternoon. First of all, I would like to thank everyone here for your presence. Today, we are launching WHO's third report on the neglected tropical diseases, or NTDs, as we commonly call them. This time, the World Health Organization has chosen the United Kingdom as venue for this launch. This is a recognition of the UK government's assistance and support to WHO's Department of Control of Neglected Tropical Diseases, which is the department I'm heading in Geneva. I would therefore like to warmly welcome and thank you, Baroness Notover, for your willingness to participate in this global event and to share with us DFID's perspective on NTDs. As Andrew just mentioned, we are also joined through video link with Addis Ababa, Ethiopia, where the report is being simultaneously launched in the presence of Honorable Dr. Kebede Werku, State Minister of Health, Ethiopia, and a host of dignitaries. We'll have the opportunity to hear reactions from them in a short while. Ladies and gentlemen, the publication of this report, Investing to Overcome the Global Impact of Neglected Tropical Diseases, is particularly timely. Allow me, therefore, to focus on some of the important investment aspects. In a previous report published in 2013, we discussed the rapid expansion of interventions and highlighted the challenge to meet funding requirements. We had promised to make evidence-based calculations which are needed to reach the NTD roadmap targets. We have these figures now. And this report looks at how countries that are affected by NTDs can make these enhanced investments to reach the WHO's 2020 roadmap targets. Current discussions around the post-2015 Sustainable Development Goals have also allowed us to look at what will be required in terms of funding for NTDs beyond 2020 in order to reach universal health coverage for all those in need of NTD interventions by 2030. Our most immediate need is to continue what we have started well, which is providing full access to large-scale preventive chemotherapy, as well as enhancing conditions for intensified case management, morbidity management, and disability prevention. We have calculated that if we live up to our roadmap targets, the number of people that will need preventive chemotherapy will decrease by 80% by 2020 and further by almost 90% by 2030. This means that substantial investment is needed now to enhance the chances of sustainability further down the road. In this report, we have calculated that for the period 2015 to 2020, the needed upfront investment, additionally to what foreign aid is already currently providing, will amount to an average of $450 million per year. Most of this investment, or an average $390 million per year, is required in low and lower middle income countries, as you can see in red in the graph behind me. The downward curve of the graph on the right shows that if we make these investments by 2020, the need will decrease substantially as we move towards 2030. This does not take into account donation of medicines that pharmaceutical companies will continue to provide and that make NTD interventions so cost-effective for the beneficiary countries. Universal health coverage is not only about coverage. It is also about equity and making sure that the most disadvantaged and marginalized populations, those that are invariably most at risk of NTDs, are not left behind in the development process. This report argues that today, about 3/4 of the world's poor live in middle-income countries. This represents 2/3 of people who require treatment and care interventions for NTDs and who also live in the same countries. Ladies and gentlemen, the report argues that providing equitable access to interventions against NTDs will be a litmus test for universal health coverage. It also looks at broader supportive measures to enhance and sustain prevention of NTDs, such as vector control, veterinary public health measures, and provision of water, sanitation, and healthy environments. Here, investment needs are more difficult to evaluate, not in terms of cost, but in terms of people at risk. We have focused on vector control to calculate an order of magnitude that such investments could represent. Why vector control? Because we believe that the spread of vector-borne diseases due to climate change and its impact on the environment, rapid, uncontrolled urbanization, and international movement of people and goods is an issue of rapidly growing concern. Particularly the spread of arbovirus-related diseases, such as dengue and chikungunya, need to be urgently addressed. The report argues that this requires attention for an entirely new agenda within the NTD portfolio. Investments in this area will need to be much higher than those required for preventive treatment and care interventions, as the graph behind me clearly shows. You'll also notice that this doesn't spare upper middle income countries. And we believe that only a considerable upfront investment now will prevent things from spinning out of control in the medium term. Such an upfront investment should include the development of new tools, products, and methods for the control of day-biting vectors, the mitigation of insecticide resistance, and the building of large-scale implementation capacity in countries. Some broad investment figures for water and sanitation towards 2030 are available elsewhere, and we considered that this was outside the scope of this report. However, what we are committed to do with our water and sanitation colleagues is to focus on the equity issue and closely monitor that poor, NTD-affected communities can benefit from water and sanitation infrastructure as a matter of priority. We haven't included veterinary public health interventions in our current projections of investment needs. This is surely not because we are giving little attention to neglected zoonotic diseases. The recent groundbreaking work that has been done on rabies prevention proves the contrary. We are now working with countries and other organizations to define packaged, cost-effective interventions that address the 3 areas involved in transmission of neglected zoonotic diseases: human, animal, and environmental health. We hope to be able to present the outcome of that work in one of our next NTD reports. This report essentially makes a strong case for the fact that universal coverage against NTDs will fail if we fail to mobilize the required resources. And the amount required towards 2020 is more than double what is currently available. With the current trend in development, there will need to be an increased commitment by developing nations and a progressive shift towards mobilization of their own resources. We all have a responsibility in working towards this, making sure that we reach our 2020 NTD roadmap targets, that the NTD agenda is part of efforts towards universal health coverage and reaching the Sustainable Development Goals, and that there is a progressive shift towards endemic countries building NTD interventions into their development agendas and domestic funding policies. As you will further be able to read in this report, progress towards the 2020 targets is sizable and steady. We are in 2015, a crucial year to take stock of progress and to adjust our approach as needed. We have started thinking more long-term, and we need to firmly but carefully transition to best practices in line with the perspective that is outlined in this report. I know that WHO can count on your commitment, collaboration, and enthusiasm to achieve this.
Thanks, Dirk. We've already heard several times about the role of the UK and particularly DFID in providing development assistance in health and to NTDs specifically. So with great pleasure, I'd like to hand over to Baroness Lindsay Northover to say a few words about the UK.
Ladies and gentlemen, distinguished guests, thank you very much indeed for the invitation to speak to you today at this wonderful institution, and I'm also very pleased to see there's something of a reasonable gender balance here. And I would like to thank previous speakers for their very generous comments on the United Kingdom's contribution. And can I give my own very personal commitment to this astonishing work? When I started out as a young academic and I was sharing a flat with an American from CDC coming from the smallpox eradication unit there, and she told me, she was working at London School of Hygiene and Tropical Medicine, and she told me about the neglected tropical diseases and the challenges that people faced, and she herself was working in particular in a related area to do with diarrhea, and received the diarrhea dialogue every month or so. When she told me about these diseases, I never would have thought that we would be in the position that we are today, and that is immensely encouraging. Every year, neglected tropical diseases, NTDs, affect the lives of over 1 billion people, causing disability, disfigurement, stigma, and an estimated 500,000 deaths amongst the poorest people of the world. You all know that. By tackling these diseases, we prevent pain, suffering, and death, and help to reduce poverty. This report and its predecessors and its successors is important because it reminds us of the great human suffering caused by NTDs, but it also highlights some spectacular progress and describes what needs to be done to ensure that indeed we leave no one behind. A couple of weeks ago, former US President Jimmy Carter was in DFID discussing NTDs, in particular the guinea worm eradication program. And in 1986, guinea worm disease affected 3.5 million people. Last year, there were only 126 cases. It's an amazing achievement, but we still have to go that final mile to eradicate the disease, and that's often the most difficult mile. I'd like to make three key points today on resources, results, and partnerships. Starting with resources, some of you may recall, and there's been reference to it, that the United Kingdom committed an additional £195 million at the London Declaration on Neglected Tropical Disease. And we're fulfilling our commitment, and we've expanded existing NTD programmes as well as launching new programmes. And today you'll hear from several partners who support NTD control. Obviously, we need to be realistic about what it will take to finish this work, over what timescales, and ensure there's adequate international funding. And that's partly what this launch is, of course, about. The donor base is too narrow, and the United Kingdom supports efforts to raise additional funding from partners. But national government leadership in the endemic countries is absolutely essential. And I must say that I'm delighted that we're in a joint arrangement here with Ethiopia. And clearly, their domestic resources must also increase if gains are to be sustained. And I note what Dr. Chan said about the excitement of governments in some of those endemic countries, seeing the end in sight of some of these terrible diseases. National parliaments have an important role to play in making the case to increase health budgets, including for NTDs. And as the report notes, for many countries, domestic investment in universal coverage against NTDs is affordable. And I also note what both Dr. Chan and Dr. Engels have just said about universal health coverage. To take India, for example, in 2012, India was delivering preventive therapy to more people than any other country, more than 420 million people. It completely covered the cost of delivering donated medicines using domestic resources. And that is a fantastic achievement. So to move to my next point, results. It's very good to learn of the progress highlighted in this report, that more people are being reached with vital treatment. And we also see that some countries have achieved remarkable success, even achieving elimination of some diseases. Last month, the WHO certified Ghana as free of guinea worm, and this is indeed a tremendous achievement. Ghana was the second most endemic country in the world in the 1990s. 2 decades of committed hard work has resulted in the country being free of the disease, and I'm sure that in this room there are those who have contributed to that, and I congratulate you for your work. As we celebrate these successes, we must also make progress in the poorest countries where the disease burden is highest. Millions of people who need treatment still do not get it. To change this, we must continually improve programs. We need to use new knowledge to refine our approach so as to get the best possible results. And I'm extremely glad that amongst all the academic institutions playing their parts, we have such strong ones in the United Kingdom. The report highlights that we need to invest as effectively as possible. Effective investment is not only about supporting the right interventions in the right places, it's also, of course, about the better delivery of NTD programs to ensure that we get the greatest possible results. I'm glad that this new report highlights the value of integrating NTD programs and working across sectors. This level of collaboration is necessary to achieve sustained control and elimination of NTDs by addressing the environmental and behavioural conditions that cause infection and reinfection. For example, and it's already been referred to, we know how vital clean water and sanitation services are to improved health. We know that from the West. It was sanitary reform that cut deaths in our cities long before antibiotics were discovered. We need to make further efforts to ensure that NTD programs work closely together and with water and sanitation services. We welcome WHO efforts to foster this collaboration. Moving to my third point on partnership, collaboration is clearly important to achieve the greatest impact. The United Kingdom works closely with donor colleagues, particularly the US Agency for International Development, and I'm glad that we have representation here today, and the Bill and Melinda Gates Foundation, as we strive together to enhance our efforts to tackle these diseases. We're committed to a well-coordinated and coherent effort to tackle NTDs. But it's also important to recognise the partnership with the pharmaceutical industry, and that has also been referred to, who make a very substantial contribution through drug donations. Most of the medicines used for neglected tropical diseases are donated, and without that vital contribution, our progress would be much slower. And again, as almost said noble lords, Lord Chris will understand why I did that. As those here will understand, clearly one of the reasons why these were so-called neglected was because the industry didn't see a profit in investing in the treatments. That is now being addressed. It will also be more costly for national health systems and development partners not to have that progress. National governments are key partners. The development and ownership of national plans and policies for NTD control are critical. So too is the capacity of health workers and volunteers to carry out NTD activities and support implementation of those strategies. A good example of this is the Global Trachoma Mapping Project, the world's largest infectious disease mapping, which is supported by the United Kingdom. The results are impressive. Nearly 2 million people have been examined in only 2 years. In the early stages of the mapping, a team mapping in southern Ethiopia didn't report for 4 days. When they were reached and when they regained contact, it turned out they'd spent 3 days building a raft out of logs to get across a flooded river to reach the community that they had to map. Now that shows commitment. And the commitment shown by the teams responsible for surveying, the support and commitment from the national government of Ethiopia has been vital in completing the mapping of trachoma in Ethiopia. It's an excellent illustration of how working in partnership is the cornerstone of successful elimination of NTDs. 2015 is a very important year with the development of the Sustainable Development Goals. The United Kingdom supports the inclusion of NTDs within the health goal, so we should. Global efforts to control and eliminate NTDs must ensure no one is left behind, as Dr. Engels said. And Dr. Chan mentioned the implications of climate change, which shows how urgent this work is. To help maintain and increase support for NTDs, it's essential that we continue to demonstrate the results and impact on the lives of some of the world's most marginalised populations. Looking ahead, there are many challenges, but working together in partnership, we can strive to make a world increasingly free of these destructive diseases. There are so many challenges today, not least of conflict, of Ebola, and that's why sustained commitment to NTDs, as shown here, is so important. I commend the World Health Organization and all the other organizations represented here today, and all the individual researchers here, for all of your efforts to improve the lives of the poorest people in the world. Thank you very much indeed.
So Baroness Northover mentioned very much the UK role of DFID and others in support, of course, research as well as funding across this country. But as she also said, we really have to think about the countries where the burden is greatest, but also where there has been this fresh momentum around leadership, and of course where there's the need for energy on the ground and also domestic funding alongside international support. So it's very important that we do hear now from our parallel partners for this launch today. We're going to move to Addis Ababa and to hear from a number of senior politicians and officials about the perspective on the ground.
Greetings from Addis Ababa, the capital of Africa United. On behalf of the WHO in Ethiopia, I would like to welcome the Federal Minister of Health of Ethiopia, the African Union, our partners and the media, and thank all of them for accepting to be part of this very important event, the launch of the third WHO Global Report on NTDs. NTDs remain a global challenge because NTDs are still neglected and they affect the poor people of the world. It is why we advocate for a global action. The time has come to scale up and sustain our interventions to ensure healthier societies for all nations. with people's involvement in the action for change. I would now like to introduce the Ethiopian State Minister of Health, His Excellency Dr. Kebede Wapu. Dr. Kebede has been serving as the State Minister of Health since October 2005. He has overseen Ethiopia's health sector reform and led the implementation of the country's flagship program, the Health Extension Program. He is a champion of innovation, task shifting, and implementation at scale. Together with His Excellency Dr. Kesetebira Matmasu, the Federal Minister of Health, he leads the NTD control and elimination effort in Ethiopia. Dr. Kebede, you have a floor.
This report, Investing to Overcome the Global Impact on Neglected Tropical Diseases, provides the first ever investment targets for sustaining advances in NTD control and achieving WHO's NTD roadmap target by 2020. While the report looks at the financial implications of achieving the WHO, anticipates what is required beyond and up until 2030 in a changing NTD landscape and is in the context of broader and equitable universal health coverage. As more endemic countries graduate to middle income status, the report also stresses the need for greater investment of domestic resources. The report comes at an opportune time when the world is prepared to welcome sustainable development goals, and as a global focus expands from development to sustainable development, from poverty eradication to shared prosperity, and from disease-specific goals to quality of health coverage. In 2013, Ethiopia renewed its commitment to fight NTDs by launching a multi-year NTD strategic plan for the control, elimination, and the eradication of targeted NTDs. Since the launch of our National NTD Master Plan in June 2013, a lot has been achieved in controlling NTDs country, development of sub-national master plan, development of guidelines and manuals for the health workers, including our health education workers, capacity building of NTD managers at various levels, and the revitalizing structures in the ministry and the states, and the advocacy and awareness raising activities. This is a successful organization of 18th GATE 2020, 20th JAF, ASGAD, and first the Swiss Alliance meetings help in bringing national advocacy and strengthening partnership for the battle against NTDs. The Federal Ministry of Health of Ethiopia launched the fast-tracking elimination of blinding trachoma, the Ethiopian initiative to clear the TT backlogs on 12th of February 2015. In order to achieve rapid success in the scaling up of control activities, we have ensured that interventions are an integral part of the existing community health system, our health extension program. To consolidate the gains made and foster community ownership, we are implementing an organized community movement called the Health Development Army. Through this homegrown initiative, we have mobilized around 3 million volunteers to work alongside our health extension workers and bring social transformation in each community. Despite all the achievements and the progress made on the fight of NTDs, there are still more to be done, and there are more people to be reached through significant scaling up. While the momentum and the commitment to eliminate NTDs has significantly increased, we have to act rapidly to increase the pace of progress towards achievements of targets. To this end, I call upon all endemic countries to pledge their firm commitment to contribute to the realization of the resolution of 66 World Health Assembly to improve domestic investment for NTDs control, elimination, and eradication. Finally, I would like to thank WHO for its leadership and our committed partners for their technical and financial support. I am confident that Ethiopia will achieve the national goals set in the global roadmap on NTDs. On behalf of the Minister of Health of Ethiopia, I would like to reaffirm my country's commitment towards integration in the scaling up of services to ensure mitigation of NTDs. I thank you.
Thank you very much, Dr. Kebede. On behalf of WHO, I would like here to acknowledge the commitment and the leadership of the Ethiopian government toward the elimination of NTDs in Ethiopia. I would like now to invite Dr. Marie Goretti Daiseba to deliver the message of the African Union Commission, the voice of the 54 African countries.
So several African countries have already begun aggressive implementation of NTD control and elimination activities. But all countries will require increasing financial and political investment to ensure that Africa meets the 2020 elimination goals. Although the burden of infectious diseases in the world has declined, neglected tropical diseases remain a major public health problem and an obstacle to development in Africa. This challenge has led over 30 African countries to develop multi-annual national strategy and the plan favor an integrated approach and the implementation of elimination plans designed to speed up NTDs control and elimination efforts. We recognize that it is one of the most cost-effective ways that we have right now to improve the health and economic contribution of our citizens. We continue also to urge member states of the African Union to organize campaigns to prevent and combat neglected tropical diseases that have a negative impact on our public health and obstruct the achievement of Millennium Development Goals. But also to implement the integrated national plan to combat the NTDs and to increase domestic financing, domestic investment of NTDs for elimination program.
I will now hand over to Mr. Andrew Jack in London for the next phase of the program.
Thank you very much, Africa United. A very important message of solidarity, and perhaps at least on this, you're more united than we are in Europe on many issues. I think your messages about the time pressures of the Millennium Development Goals of 2015 and how there'll be a rebalancing and the need to maintain momentum. I'd like to turn back now to London and ask Jeremy Lefroy, the chairman of the all-party group on malaria and neglected tropical diseases, to share his thoughts on the role against NTDs.
Investment in overcoming neglected tropical diseases makes so much sense. It makes sense, firstly, because these are diseases which typically affect the poorest and most marginalised people. And if we tackle them, we are treating some of the root causes of both extreme poverty and of inequality, which is what our work must be all about. It also makes sense because systems for preventing and treating NTDs can be extremely effective in building and reinforcing systems for universal health coverage, which we must achieve as soon as possible. The International Development Committee of the United Kingdom Parliament, of which I'm a member, recently produced a report on strengthening health systems. While welcoming the great progress which has been made through this focus on specific killers, such as malaria, tuberculosis, or HIV/AIDS, we stress the need for those programs to be integrated within universal health systems rather than being in parallel to them. The work on NTDs is already showing the way for this. Last week in Nepal, we on the IDC saw how programs to tackle, for instance, lymphatic filariasis and the soil-transmitted helminths are part of the national health system, among other NTDs which are tackled. And I've seen that personally in Tanzania too, where there are government-run programs against up to 4 NTDs in a district with the support of SCI and others. Good investment in overcoming neglected tropical diseases will strengthen health systems and is therefore an important building block towards universal health coverage, especially among the most needy. And it makes sense too because it's all about cooperation. It's about cooperation firstly between the governments, then between multilateral and bilateral institutions, between research bodies, between NGOs and, of course, last but not least, the private sector. And finally, it makes sense because it's eminently achievable. The amounts which the report set out, 32 billion over 15 years, including vector control, but excluding donated drugs, an average of just over $2 billion a year, may seem very large. But when you consider that the amount which it costs to run our own United Kingdom National Health Service for 4 days is around about $2 billion, you gain some perspective of this amount. The report makes it quite clear that much of this investment will come and must come from domestic resources, as the previous speaker referred to, and not from donors. It points out that the largest burden of NTDs falls upon the poor in middle-income countries, where health spending is hardly dependent at all on foreign donors, where they take that responsibility fully or almost fully upon their own shoulders. And the report makes it quite clear that, nevertheless, we need an increased and sustained contribution from donors over the next 15 years. And this is particularly important to support the development of new drugs, vaccines, and other tools, and also for operational research on the development of effective delivery systems, and last but certainly not least, as again the previous speaker pointed out, the work in fragile and conflict-affected states which may not be able to generate those domestic resources. I was absolutely delighted when this United Kingdom government increased its commitment, as Baroness Lindsay Northover mentioned earlier, to tackling NTDs to £245 million over the spending period. And I'm very grateful to the previous Secretary of State, Andrew Mitchell, the Minister, Stephen O'Brien, and Lynn Featherstone, and of course the continued support from the Secretary of State, Justine Greening, and Baroness Northover herself. The All-Party Parliamentary Group, which I chair, is, as its name suggests, a group of all parties working together because we don't have differences on this issue. And we are publishing our final report of this Parliament next week. In it, we strongly recommend that the next United Kingdom government maintains its financial commitment to NTDs. Given that the UK's development work is focused on the elimination of poverty worldwide, and tackling NTDs does that so effectively and cheaply, I see no reason at all why it should not do so. Thank you.
Thanks very much. We're flitting around the world a bit today, and now we're going to hear by video message from Tim Evans, the Senior Director of Health, Nutrition and Population Global Practice at the World Bank.
Good afternoon. I'm pleased to speak with you today to help launch the third WHO report on neglected tropical diseases, entitled Investing to Overcome the Global Impact of NTDs. Eliminating these diseases, which include river blindness, guinea worm, schistosomiasis, and trachoma, among others, is of central importance to the World Bank Group as we work towards our twin goals of ending extreme poverty and boosting prosperity. NTDs affect the poor disproportionately. They pose major constraints on people's health, education, and earnings potential, and they cost developing economies billions of dollars every year. As such, they are truly diseases of poverty. Investing to overcome the impact of these diseases makes good sense. It provides a boost to people's intellectual and physical development, which together increases productivity and long-term earnings. The health and economic returns to investments in NTD control are perhaps no better seen than in the benefits accruing from 40 years of onchocerciasis control in West Africa. There, hundreds of thousands of people have been freed from blindness, and fertile river valleys are no longer abandoned. Moreover, the last-mile community-based infrastructure to facilitate universal access to ivermectin has proven to be a polyvalent platform for providing cost-effective frontline services to the poor. From the World Bank's perspective, we are delighted by the focus of this year's report on investment. Greater investment in health is critical, but we need to think more strategically about how development assistance can promote smart, scaled, and sustainable financing of NTDs, as well as other health priorities. The bank is working with a number of countries, starting in Africa, towards strengthening the financing and delivery of national NTD programs. This includes investments in NTD programs through IDA, the World Bank's Fund for the Poorest Countries, as well as aligning the NTD agenda with innovative delivery mechanisms such as a new approach to seasonal malaria control. Smart, scaled, and sustainable investments are critical inputs to achieving the WHO roadmap to control, eliminate, or eradicate NTDs by 2020, as well as universal coverage against NTDs by 2030. This important third WHO report goes a long way to provide us with the investment targets and roadmap to get there. So congratulations to WHO and its partners. I wish you all a fruitful launch and look forward to taking the report's findings forward. Thank you.
Thanks. I probably ruined protocol by switching the order here, but we're now going to move to Nigel Christ, the former Chief Executive of the NHS, who might be able to comment, amongst other things, on Jeremy's sobering statistic of the costs over 4 days. But of course, Nigel not only was Chief Executive of the NHS and then became a Lord, but also remains very active in innovation, or the author of Turning the World Upside Down, and amongst his other commitments today is the chair of Sight Savers International.
Honourable Ministers in Ethiopia and in the UK, and distinguished ladies and gentlemen, it's a real pleasure to be here to welcome what is, I think, an excellent report. I do so with two hats on, I think. I co-chair the all-party parliamentary group on global health here in the UK, and I also, as just been said, chair Sight Savers. So, and it's in that last role I know a little bit about the extraordinary impact that these programs that we're talking about can have on people's lives, and how they can turn them round really very quickly and very impressively. To get things done, you need three things. You need will, and by that I mean political will and determination to get things done. You need ideas, knowing how to get things done, and then you need delivery, actually making it happen. And if I look at those three things here, we're in a happy moment when we've got all three coming together. We have got this extraordinary political will, which we're hearing, backed up by resource. We've heard from the WHO, the World Bank, and indeed the British government, and British parliamentarians who are determined to make sure this goes into the next parliament. I'm certainly going to be supporting you from our end of the building, Jeremy, on that. So we've got the will. We've got the idea, and in doing that, let me just pay tribute to the WHO, to DFID, to USAID, to Gates, to the Queen Elizabeth II Diamond Jubilee Trust, to the pharma companies, and indeed to the national governments in Ethiopia and elsewhere, who are actually determined that they're going to make this happen and that you can do it. Without that, you're not going to get anywhere. The second thing we've got is we've got the ideas. We know how to do it. And that's a tribute to people who over 25 and 30 years have been researching and working away quietly, out of sight, I suspect, and now suddenly find themselves with a major priority or global attention. I hope that's a great pleasure to those people, but they've created the ability for us to take it forward. And then the final thing is, having done all that, you still need a delivery system. And this is where, as chair of Sight Savers, I think specifically about onchocerciasis and also blinding trachoma. And it is, and I'm echoing something of what Baroness Northover said, it is an extraordinary effort that goes into this, and indeed what Jeremy Lefroy said. There are so many links in the chain, from the global level with all the different organisations, at the national level, what you have to do nationally, the universities, the NGOs, WASH, the water and sanitation and hygiene community. So it's not just those directly involved in health. And I look at that as a former chief executive and think, what an extraordinary governance problem. This could fail in so many places, and it doesn't. And it doesn't because of the people. It doesn't because there is that absolute determination to build a raft across a river, or whatever we've heard of. It is an extraordinary achievement. And I think it is an example to other areas of health and social provision. This is, textbook stuff. And I hope that this is all, I'm sure it is, being written up in those ways, because it is such a great example of global solidarity, and global solidarity actually working, as we've heard people say. So, privileged to be here today, celebrating what's been achieved, but also promoting this report, which sets out clearly what's needed in the next vital stages on this tremendous journey. This is a job that is underway, but is by no means finished. there is much more to do. So let me end just by adding my congratulations to Dr. Engels and his team of epidemiologists and economists and others for putting together the evidence so we can see what's needed now to make that next push in this next steps in this vital journey. Thank you very much.
Thanks. And now we'll move to Janet Hemingway, Director of the Liverpool School of Tropical Medicine.
If you look at the list of neglected tropical diseases that we're dealing with, a huge number of those are actually transmitted by insects of various guises. And I think the emphasis that you've heard from Dirk and others in terms of looking at the vector control is timely. Because if we really are going to get sustainable elimination of these diseases, then vector control is going to have to play a part in each of those. And if we don't get ahead of that curve, and we're always behind that curve, then we're going to struggle with that. We've got a real difference between some of these diseases, though, and there's some that is really low-hanging fruit. So if you look at what is going on at the moment with the trypanosomiasis, the African TRIPS sort of program, you'll see in the report that most of that concentrates on the drugs. But alongside that, there are something called tiny targets. Tiny targets are very small targets of cloth that the women in DRC are now actually putting out around the villages, supported by the Gates Foundation, working with industry and coming out of the Liverpool School. And those tiny targets will actually help control the tsetse flies that actually are transmitting the disease so that we get sustainability and the remnants of hat that we're seeing predominantly in DRC can actually be controlled. Equally, if you look at Chagas, we've got a very slow beast there in the triatomid bug that doesn't reproduce very quickly, that doesn't develop resistance very quickly. The tools and technologies that we've got today work beautifully to control that bug. And you've seen the benefits of that by what has been going on in the Chagas program. But if we move on from there, from some of the other insect-transmitted diseases, visceral leishmaniasis, we've got sandflies. I'm going to test you on all of this later to make sure you at least understand which insect transmits what. The sandflies, again, relatively small beasts, but they do reproduce quickly, so they are going to develop resistance. But at the moment, we don't have a huge amount of that. Bit of resistance to DDT, not much else. So if we do control properly for VL, we can get ahead of that, and indoor residual spraying as a technology that's been around for a long time will actually take us to the point of controlling VL, done sensibly. We just need to make sure that we appropriately apply the tools that we've got. Similarly with the black flies and onchocerciasis, I think what went on with the OCP program and others, we know how to do that. The vectors are sitting in limited areas, and we've got very good means of actually taking those forward. But now let's move on to the more difficult ones. Because the ones that really worry me, and I'm now coming back to my chikungunya hat, are the dengue, chikungunya, the arboviral diseases. Because there we've got a mosquito that travels. It hitchhikes around the world in all sorts of guises, be that desiccated eggs that can sit in tyres or anything else that gets sent around the world, or it moves in close association with humans in planes and boats and trains. And that is a really difficult insect to actually control. You're seeing that in terms of its spread. Geographically, Aedes aegypti, Aedes albopictus, the two major vectors, have been moving very rapidly around the world. And they're taking diseases like dengue and chikungunya into areas that haven't had them before. And those are going into large-scale urban areas that are going to be really difficult to sort out. We can tell you what doesn't work in terms of the vector control today with those insects, but neither I nor anybody else can tell you what does work very well. And so there is a job to be done in terms of taking that forward. Alongside that, back to my old hat again of insecticide resistance. 35 years ago, it was starting to be a problem. Today, it's an enormous problem. We have vast amounts of pyrethroid resistance in the malaria vectors, and that's the story everybody knows. But Aedes aegypti is equally as resistant to pyrethroids. And we have it coming through in some of the other insects, Culex, for example, that transmits lymphatic filariasis, very difficult to kill with the insecticides that we've got at the moment. The Gates Foundation and others have been funding the program the IVCC programme, and that is developing a great pipeline of new active ingredients that will come through. But as a community, we have the responsibility of making sure that when those new active ingredients become available, we have proper resistance management systems in place so that those are there not just for our generation, but for generations to come, because we can't afford to put them out there and kill them as we have with the pyrethroids by using them incorrectly for the vector control activities that we've got. So I guess my message is that we've got quite a lot to be done. It's great that some of the focus is coming this way. We can get better and smarter at what we do. And if we get better and smarter at what we can do it at a lower cost as well, so that we don't have to go with massive blanket treatments. We can focalise our control efforts where they're really needed. But that's going to take time and energy, and I do welcome the fact that that's come onto the agenda. So thank you for giving me a little time to actually highlight this as we move forward.
Well, thanks for that reminder that we can't stand still. There has to still be a lot of energy around new innovation as well to keep up with resistance. So now we're going to switch to Donald Bundy, Senior Advisor for Neglected Tropical Diseases at the Gates Foundation, formerly at the World Bank and an epidemiologist at Oxford University.
Ladies and gentlemen, it's a wonderful room here, and I think there's a certain symmetry in the fact that we're discussing how to end some of the diseases that were first described in this building. And that's a great opportunity that we face that. This is an excellent report, the third report of WHO. It's a report that has some very positive messages. It's a report that gives us some good news to share. The fact that the coverage with ivermectin of more than 100 million people a year in Africa now means that the 80% coverage goal is nearly achieved. The story that Baroness Northover told us about the extraordinary rapid mapping of trachoma has set the bar higher for all of the NTDs, and we need to follow that goal. And the control of schistosomiasis, an area that's lagged behind some of the other NTDs, is now much more within our grasp because of the doubling of the availability of praziquantel. That donation has now moved forward. So there's some real success stories there, but amongst all of that success, we shouldn't gloss over that there are some real challenges. We still have major problems in terms of thinking about delivering the donated drugs for some of the diseases, some of the major NTD diseases, both lymphatic filariasis and the soil-transmitted helminths. We still have yet to reach 50% of the coverage that we need to be at in order to take forward the roadmap goals. We also know that there are significant concerns about the quality and timeliness of the data we have on what the coverage is that's actually being achieved. These are matters we need to take very seriously. We need to work together, all of us, to try and address those. There is a message in the report which I think is really, really important, and which Jeremy Lefroy also pointed out. This report is the third major effort to estimate the costs of delivering the donated medicines, and by far the most comprehensive effort in that direction. The previous two were one funded by the Gates Foundation with Abt Associates, and the other by WHO Afro for Africa. The extraordinary finding is that these reports, these analyses, all show remarkable similarity in the total costs. That we're talking around $300 to $400 million a year as the cost at the country level that needs to be met in order to deliver what are several billion dollars worth of donated medicines. Trying to give a sense of the cost of what does $300 or $400 million actually, how does that matter in a political sense? We can turn to the Lancet Commission on Investing in Health, which published its results in December of last year, and estimated that the overall bill to bring low-income countries, to converge low-income country health with middle-income country health by 2030 was on average $70 billion a year. This means that with $300 to $400 million, we're talking much less than 1% of that overall bill, much less than 1%. And what that reflects is the extraordinary value for money of addressing the NTDs. And that's a message that we need to get over more clearly, and one which I think that the report will very much help in taking forward. The Foundation's annual letter from Bill and Melinda Gates themselves this year specifically highlights the effects and the efforts to eliminate NTDs, thus reaffirming the Foundation's continuing commitment to help end these diseases of neglected people. Congratulations to Dr. Engels and his team for an excellent report.
So we've heard from DFID, from endemic countries. We've heard mention of the drug companies and philanthropists, of course, who've all been very actively involved. And we're yet to hear, of course, from one of the largest bilateral supporters, one of the international leaders in NTD financing, the US. So I get to turn to Emily Wainwright, Senior Operations Advisor for NTDs at USAID.
I think the theme of the World Health Report for neglected tropical diseases, investing to overcome the global impact of neglected tropical diseases, comes at a critical point to alter the current trajectory for the 2020 NTD goals. The report notes that over 5 billion treatments have been provided since 2006. This success falls at the midpoint to the 2020 NTD goals. The growing success has involved many, but has benefited from a strong partnership of industry, host country governments, and foreign assistance. In having the pleasure of leading the NTD efforts at the U.S. Agency for International Development on behalf of the U.S. government, I would like to acknowledge the commitment of the UK government to NTDs and the invaluable partnership with DFID, which has allowed us as agencies collectively to reach individuals and have greater public health impact and reduce poverty through that collaboration. The combined resources are reaching 94 countries. And the US government knows that the UK government is also looking at elections on the horizon, and I hope that we all survive this process and can continue this fruitful relationship for the next 5 years, so that we're still here in 2020 celebrating that success with the countries. This has really been an extraordinary partnership that has, I would say that in the field of NTDs, I don't think we look to the UK and DFID as a partnership, but it's more of a brotherhood in NTDs. And it's been based in not just the finances, but actually the strategic partnering that's allowed us to work so effectively. So just thank you, and we just appreciate that role. As the report notes, the UK and US governments provide the bulk of foreign assistance to NTDs, and in particular, support to distribute the generously donated drugs. Though the agencies make up a significant proportion of the 200 to 300 million a year mentioned, there is still the current gap of approximately $450 million. Despite increased advocacy efforts and new partnerships, the climate for unlocking new resources for NTDs proves to be challenging in the face of competing priorities, such as Ebola and civil unrest. As the report indicates, it's unrealistic to expect that NTDs can or will be covered disproportionately by foreign assistance, especially in the context of trying to achieve universal health coverage. The timing of the message in this report is well placed. If we maintain the status quo, we will not achieve the 2020 goals. The need for new resources is critical, and they need to be identified now. With NTDs becoming more widely spread in middle-income countries, we look to the leadership of these governments to increase domestic resources for NTDs. Unlocking these resources will allow foreign assistance from the US or the UK to target more lower income countries and support innovation. The timing of the report aligns with the conversation around the Sustainable Development Goals and an opening in domestic agendas to discuss NTDs. The Honorable Minister of Health from Ethiopia has demonstrated that leadership, with Ethiopia committing resources alongside donor support and challenging his peers throughout Africa to increase their investments in NTDs. The 2020 is only 5 years away, but in comparison to other health issues, dramatic progress can occur in this window. The pharmaceutical companies have removed the major barrier, but the current resource environment will not allow it to be fully leveraged. In order to put these poverty-promoting diseases to rest, we need countries to begin filling the financial gap and help lead us through the next 5 years so that this unique opportunity can be achieved. Thank you.
Thanks. And now to sum up, I'm going to turn to the man who was the editor of this report, Professor Peter Holmes, who's the chair of the WHO's Strategic Technical Advisory Group for NTDs.
And lots of points I'm going to make clearly have been made already very well. So, honourable ministers, distinguished guests, ladies and gentlemen, particularly colleagues in Ethiopia, I always welcome the opportunity to try out my Amharic again and say Tanasteling betam existeling. I think this is a really important report. Good. I think it was a gap in the work that's been done on the NTDs. I think it was a gap that was recognized by WHO, and I'm really delighted that this third report really addresses this really important area of investment and making the investment case. And I'd like to just pick up a few kind of common themes that have come through, kind of take-home messages that have come through in the afternoon. I think it's really interesting, in fact, that most people now requiring NTD and suffering from NTDs and requiring treatment for NTDs now live in middle-income countries. I think that's kind of not widely recognized. I think they've been recognized, though, as a proxy for poverty. But I think what is now interesting, it's also a proxy for inadequate and inequitable access to healthcare systems and healthcare universal health cover. And I think that's an important development. I think it's also important that we start to move, of course, away from what has been a vertical disease program of control to horizontal. And as we have successes with NTDs, and we've heard about guinea worm, for example, and there have been others, it's really important that these NTDs don't fall below the radar. We had a very bad or good example with human African trypanosomiasis when we were well on the way to controlling that disease, and kind of the eye went off the ball, and the number of cases dramatically increased. I'm very pleased, and Janet Hemingway mentioned this, that we're back again to a very low number of cases, and I hope we can see the job right through. But that final mile, I think, is often really very important. NTDs can also be seen as a canary in the mine for climate-sensitive diseases, and we're particularly sensitive and aware of vector-borne diseases, which Janet mentioned. It's really crucial that we continue to address these issues as the risks from vector-borne diseases grows enormously. I'd also like to just highlight, and it's not yet covered in this report, but hopefully will be in future reports, the importance of zoonotic diseases. 4 of our 17 neglected tropical diseases with capital N, T, and D are in fact zoonotic diseases. And by controlling those zoonotic diseases, we not only bring benefits to humans, of course, that are affected by these diseases, but we benefit their livestock, and we get a kind of double benefit to health and healthier incomes from livestock. Monitoring of universal healthcare is increasingly focused on 2 discrete components. It's about the level of coverage, and it's also about financial protection for out-of-pocket expenses. To be affected by a neglected tropical disease can be a financial disaster for many families, and that aspect of covering those out-of-pocket expenses is a very important, I think, element that has been picked up. Many people have recognized the enormous contribution that's been made by the aid organizations, the fantastic contribution by the pharmaceutical industry, totally unprecedented that such vast amounts of drugs are being provided free. But we must remember that a vast contribution is also being made by the affected countries. Most of, in fact, of the contribution has been made by affected countries, and we congratulate them on what they are achieving. In terms of investment, it's just been highlighted, we're talking about 1% of domestic expenditure on health, which is really a very small amount when you look at the other challenges. It is relatively cheap, and we have most of the tools for addressing these NTDs, but I think it's really important that we do not forget that it's really important to continue to look for better methods of diagnosis, epidemiological tools, and better treatments. Again, I would thank the Gates Foundation for the help they've given in supporting work on many of these treatments, which are now hopefully coming through. We're talking about $2 billion a year, which by some standards is, of course, very high, and we know that it will involve at least a doubling of current aid. But it's perhaps just worth mentioning that the Europe actually spends £10 billion a year on dog food. So in terms of amounts, it's not huge. So just to conclude, I think this is a landmark report. I think it moves the future of NTD control to a new level. I congratulate WHO on taking the effort and energy to produce it. I think it highlights challenges and opportunities, particularly between 2020 and 2030. The roadmap is hugely important, but it takes us only to 2020, and it's really important that we now look beyond that. I would like to just finally say that I think 2015 is a crucial year. It's an opportunity to take stock of the progress we've made going along the roadmap. A lot has been achieved. A lot needs to be done. And I'm sure we can go forward together and do that. And just to finish, I would say that the control and elimination of NTDs, I think, are a sensitive indicator of both poverty alleviation and universal health coverage. And for the representative of how developing countries care for the health of their poorest sections, we can assess them by how they tackle the NTDs. So thank you again, and thanks for your attendance.
Let me just pull out a few tiny threads. So we've heard about the huge burden, often unseen. We've heard about the value for money of these interventions to deliver a lot with a little. We've heard about the importance of the cross-sectoral and the integration into WASH and education, about exciting stories of progress towards elimination, eradication in countries like Ghana with diseases like guinea worm. The importance, though, of the final mile, and particularly, perhaps, as Nigel said, that humility, perhaps, to move towards shared delivery and cooperation between partners on the ground, about the essential need for continued innovation, for greater use, but also more responsible increased use of insecticides and other things to ensure we can tackle resistance while we develop new and innovative approaches. The proxy in which, in many ways, NTDs are for poverty and the absence of universal health coverage. And that, as we heard, as Don said, how communities are too poor even to give away free medicines, or as Lorenzo said, how we have now more drugs than we can actually distribute, a real challenge about implementation, and about that $1 to $2 billion a year gap, modest compared to dog food or even the NHS. And as Nigel said also, so we've had the ideas, there's the will, now the delivery. I think 5 years ago, we could have had a very short meeting on NTDs and be done in 15 minutes. If we're squeezing at the two ends of 2 hours here, that just really does say something about the testimony to how much more momentum and interest and possibility there is today. So thank you, Addis United. Thank you, London United. Or perhaps, I don't know, Brotherhood is great, although perhaps a little bit gender sensitive, but partnership, NTD united at least, it will be great to take stock next year and years after. So thank you for coming, and do continue the conversation at our reception afterwards.